We have Dr. Welty from over at KSB. Thank you for joining us here today and chatting on the subject.
You're welcome.
And it's hardly just today. You took part in a think tank that we had here at the office a few weeks ago, and you guys certainly got me well on my way with all the information that I gleaned from that meeting. Talk to me a little bit about your role over at Newman High School. You work very closely with Antioch RD and obviously Mike Paposi, the athletic director over there as well. And Mike, obviously been around the block several times, longtime football coach, but he truly has made this subject and taking care of his athletes, he's made it yours and Andy's baby.
Well, Christopher, I started about 14 years ago with the Newman football team when my oldest of my three sons was playing football at Newman, and Mike invited me to join them as their sideline physician. Working with Andy Accardi has been a tremendous experience. Andy is very gifted in the area of sports medicine and has not only helped develop the program for concussion there at Newman, but kept me on my toes for this subject as well.
And it sounds like he's really constantly doing the legwork to stay with the times and always be up to date on all the new information, which is incredibly important. Over these past couple of years, we've seen a lot more concussions diagnosed, which a lot of people look at the number of concussions that are diagnosed, and some people are troubled by that, but I actually find it downright encouraging that they are being diagnosed and they are being treated. There aren't more concussions being suffered. There's simply more that are being diagnosed and being nipped in the bud, so to speak.
Yes, I think the awareness about this topic has built, and I think not only for those of us that are caring for a concussion, but among the athletes themselves. I think we've started to make some inroads into helping the athletes understand the impact that this type of an injury has on their performance now and for their future health as well.
Yourself, your sons, have you dealt with any concussions in your family?
Actually, yes. My middle of my three sons, Christopher, experienced two separate concussions during his high school athletic career. One was during football, and the second, which was actually the more severe of the two, was actually sustained during a basketball practice.
And it really goes to show that a lot of them do take place in football. Obviously, a lot of impact in the game, but it can really take place in just about any sport. As we discussed, cheerleading is a sport in which they happen downright regularly. And a lot of the athletes who I've covered over the years, you see them in basketball, baseball, etc. So obviously you have a lot of NFL players who've been very outspoken on the topic, but I think one misperception is that it's strictly a football injury, not really the case at all.
No, it's not. And in fact, we've taken on the task at Newman of utilizing our pre-participation assessment tool and trying to spread that among all the athletic activities where there could be any potential chance for it.
And what is it like when you're in the thick of a season and you do have a player who you suspect could have suffered a concussion, and you reestablish that test and you have your baseline and you compare it against it? How hard is it to share that sort of news with an athlete, because you know that they don't want to come out of the game? It's obvious.
That's correct, and the fortunate thing that I've had is I've had a very supportive coaching staff to work with at Newman. Mike Paposi in particular made it clear from the very beginning that if I said player can't participate, there would be no questioning until I said he's ready to participate again. And that has truly been the case for the entire time that I've been there. It is always a disappointment for the athletes, but I believe that once they realize that you have their best interest in mind and talk them through the potential things that could happen to them if we didn't take care of this properly, they seem to get their arms around it and understand over a period of time. It may take them a couple of days, a week, but they do seem to understand.
Now, how valuable is it that yourself and Andy are around these athletes regularly, that they know you guys, they recognize the face, and that they trust you?
I think that relationship and rapport that we're able to establish with the athletes goes a long way. In cases where there may be some question going on from outside sources, whether that be other athletes or parents, that reassurance that somebody that's been there and seems to care about me goes a long, long way for these kids listening to you.
when we had that meeting here, I think it was about a month ago now, one of the things that you addressed is that, this series that we're working on, the hidden injury, it's a series that, it's a subject that can make people potentially uncomfortable. Something as, it is a brain injury. There is, brain trauma that can be suffered in concussions, but really what we're trying to do, as we established, is create awareness on the subject. Talk to me about the leaps and bounds by which the awareness has grown, and it just seems as though the more awareness that is created, obviously, the greater good stands to benefit.
Well, over the years, of course, this injury has been talked about getting dinged, getting your cage rattled, and very frequently athletes would be put back into participation during that same event after having had something like that occur. Mm-hmm. We now know enough about that to be aware that one of the most important things is to avoid something called second impact syndrome, where before that athlete has healed from that concussion, they sustain a second event. Mm-hmm. This may not only be in the same event that they're participating in when it occurs, but could be even days later if they have not fully recovered from that first event. So I think that's one of the biggest inroads, in that we are aware that we need to remove these athletes from play, properly assess them before they return to play, and then once you're returning them to play, do that in a graded fashion.
There's a reason why we called the series the hidden injury, and it's the fact that if it's a mild concussion and an athlete gets a scan and gets tested, it's not something that will necessarily show up. It's got to be something where it's kind of an imperfect science in terms of learning over the years in order to determine whether or not an athlete is at risk, or if an athlete suffered a concussion. Can you kind of just talk to me about how over the years, I assume you've gotten better at it and refined the craft a little bit, but it's got to be something that's never quite easy, because you flat out just can't put your thumb on it with an examination.
I think the tools that we use to assess this, both our immediate objective assessment of the athlete is a piece, the pre-season assessment tool that we use, which involves some memory testing and orientation testing, to be able to compare that gives us good objective information when we're doing this as well. Knowing our kids, and that's again where Coach Carty comes in as a great asset. Are they just not acting like their normal self? Do you have someone that all of a sudden is laughy and giddy that is usually a very serious player, or the other way around?
Vice versa, right?
In fact, it is not uncommon for us to have some of our players actually be the ones to make us aware that something is going on with one of the other players, because they've recognized that they aren't acting normal out there on the field. So you put all those things together, and I think those pieces come together as a puzzle, if you will, that help you to make that proper assessment. We have even had occasions at Newman where teachers have made us aware. A Monday after a Friday night game, somebody's just not clicking in the classroom like they normally do. That can be another piece that we add into that puzzle and help us realize that there might be a problem going on.
Well, I think schools like Newman, Sterling, obviously Rock Falls, very, very blessed to have the staff that they have. Looking forward, how great would it be, for all the schools to have an Antioch RD or a Shane Brown, somebody who's constantly around the kids and has established that rapport.
I think it's a huge part of being able to do adequate assessments on these players. So yes, it'd be a tremendous resource if we could get that in all of our schools.
Well, I greatly appreciate you taking some extra time. You've been, like I mentioned earlier, been a tremendous assistance during this project.
We'll certainly happy to continue to participate in this. In the end, what it's all about is taking care of our athletes well, and if this will provide any benefit to that, I'm more than happy to spend the time doing it.
That's certainly the idea. Well, thanks very much for dropping by, and we'll check in soon.
You're welcome.